very warm welcome and a good afternoon to this 27th CQE series, and the theme being Role of Quality and Safety for Dental Facilities. A warm welcome to the faculty, to all the governing committee members, to all the participants and the delegates who have joined for this session. I am Dr. Anna George. I am currently working as the head quality for Aster DM Healthcare India, and I'm also the secretary for the Quality Professionals Wing of CAHO, and really glad to be a part of this episode. CAHO is a non-profit organization dedicated to promoting patient safety, quality, and accreditation in the healthcare delivery ecosystem through structured training programs aimed at imparting relevant healthcare quality skills to healthcare workers. CAHO has trained over 16,000 clinical and non-clinical healthcare workers and till date, and it's an institutional member of the International Society for Quality in Healthcare, that's ISQA, and the Asian Society for Quality in Healthcare, ASQA, and an elected member on the executive board of ASQA. CAHO is led by a visionary leadership team headed by our CAHO president, Dr. Vijay Agarwal, and our general secretary, Dr. Lalu Joseph, and many more governing committee members. This webinar is organized by the Quality Professionals Wing of CAHO. It is one of the three main verticals of CAHO and is dedicated to nurturing the professional needs of healthcare workers, especially those responsible for quality in their institutes. So this webinar is a 3-hour webinar, and this is the 27th series we conduct every month, about a 3-hour webinar that is held. And these sessions are streamed not only in India, but also internationally as well. On behalf of the Governing Council of CAHO, once again, I welcome everyone to the program and look forward to an engaging session from all the speakers. We have two wonderful MCs to guide us through today's program. We have Ms. Debdatta, who is currently the quality head at Tata Trust Network Hospitals, also a CAHO zonal representative for our Quality Professionals Wing. And we have Ms. Archana Shahi, who is a research associate at the University Center of Excellence in Research at Baba Farid University of Health Sciences. I hand over to our MCs for today, Ms. Debdatta and Ms. Archana Shahi. Over to you.
Thank you, Dr. Anna, for the warm welcome. So to open the session, I would like to request Dr. Sharath Shetty, who is the organizing chair for today's session. So, sir is an eminent speaker and faculty. He had completed his BDS and MDS in prosthetic dentistry and from Government Dental College and Hospital, Mumbai. And he's ex-associate professor, Department of Prosthetic Dentistry, and had teaching experience over more than 15 years. He is ex-editor, Journal of Dental Implant for 6 years, president, Indian Society of Oral Implantologist, and faculty of many organizations over the years. And he has publications in various national and international journals also. So I welcome Dr. Sharath Shetty to inaugurate the session with his speech. So welcome, sir, for your inaugural speech. Now to carry on the session. So our first session is on planning of a dental clinic. So as we all know, to start off any foundation, so the planning is very important aspect. So strategic planning, designing, organizing, skill and attention to all minute details is very much required. So with this note, I would like to request Dr. Vinod Singh, sir, to take up this session, our first session. He is a young and dynamic healthcare consultant having healthcare designing and business management expertise over 15 years. And he is expert in hospital project management, feasibility studies, budgeting, equipment planning, and procurement. And his area of interest is public speaking, mentoring, pro bono consulting, and many other activities. So I welcome Dr. Vinod Singh, sir, to take up the first session on planning and designing of a dental clinic. Over to you, sir.
Hello, and I, as the chair, am thrilled to welcome all our delegates from different corners of the world joining us in today's event of CAHO, the 27th one, specially dedicated to quality and safety in dental facilities. I must thank the team Kaho for their persistent work in creating awareness of quality health services in India to international standards and continuously and tirelessly doing it all time. For today's event, I must say that dentistry is constantly evolving and dentists need to constantly renew their knowledge and information and take into account the latest development. Today, being ahead of time is what our customers expect from us. This online event is a great spur for our continuous learning and professional development as it promises to be an enlightening experience. And I'm sure you will find both informative and inspiring. I thank all the appointed experts who will share their experiences relevant to modern era's dental clinical practice, touching many aspects of dental practice with pointed focus on accepted standards, regulatory, safety, and quality measure, which most of us are not aware. We must remain vigilant and do our part in maintaining a safe workplace so that we and our colleagues can go home safe and healthy at the end of each working day. The aim is to step back, take stock, and review our activities and safety protocols to ensure safe operations. Now, for all the delegates who are attending today's show, feel free to interact with your questions in the chat box and we'll address them to our speakers. And all your passionate questions will be answered either today or later in the group. So buckle up for a knowledge, collaboration, and growth journey. Enjoy the session.
Good afternoon, everyone. My topic is very important from the perspective of setting up a dental clinic, because the first thing that we do in order to set up a clinic is we do a planning and designing of a clinic, depending on the space that you have, depending on the number of dental chairs that you want to keep up, and also depending on the number of services that you want to offer. Okay, not just the dental clinical services, but also in terms of the support services that you want to offer, right? So we'll go step by step. We have the requirements as per the Clinical Establishment Act. And there are certain requirements in terms of space, equipments, and also in terms of requirements for the X-ray, then human resource. But we'll specifically go into the Clinical Establishment Act, which is the minimum space requirement. Okay. In terms of the minimum space requirement, when we talk about the moment you enter into a dental clinic, the first thing that you encounter is the ambience, which is where our space for the reception and the waiting area comes into the picture. Now, if you have a single dental chair, then we're looking at somewhere about 35 to 50 square feet of waiting area. I mean, that will be suffice for, say, around maybe 8 to 10 of the waiting area chairs, the 3-seater airport seaters that we see, 3 or 4 seaters. But you should not be limiting yourself to this kind of a space calculation, because when we talk about the waiting area space, more is the better. We're only showing you here the minimum space requirement, but it doesn't mean that we have to stick to this, okay? So 100 square feet of single dental chair unit, we have to give somewhere about 35 to 50 square feet of space of the reception and waiting area. But these days, you can go to any of the better and bigger dental clinics, you'll probably find 150 to 200 square feet of space for the reception and waiting area, because that's the ambience and that's the first point of contact between your clinic and the patients. So smaller the waiting area, you do not get that kind of a luxury or the ambience or the look and feel. Okay, so common area plays a very important role. Now, majority of the times, the patients who go into the clinical part, which is on the dental chair, they will also bring some visitors along. So the visitors needs to be, they need to be occupied with something. So if you don't have a bigger waiting area and if you don't have a better ambience, you're not really engaging the patients, visitors into something in terms of educating them for the dental health, educating them in terms of some kind of activities related to your dental practice and dental clinic, some kind of activities related to, what are the upcoming advances in the dental field and so on. So that being the reason, common area, which is the main waiting space, becomes all the more important. We give more importance to this area and slightly lesser importance to the clinical area, because it is the patient who is on the dental chair and most of the times he doesn't even see things around him. So this is more from the ambience perspective. And when you go inside the clinical part, which is the operating area, you have the dental chair and the washing area and the biomedical waste bins that you see. So we would be looking at somewhere about one dental chair will have about 60 to 80 square feet of dental chair unit. Now this operating area we will require depending on how much of space is available. Sometimes if you have a dental chair unit, maybe a single or two dental chair unit, then you should be looking at somewhere about 500 to 800 square feet of space. This includes the waiting area, then clinical area, then visitor's toilet, and then the dark room and other ancillary areas, biomedical waste, and maybe a little bit of maybe a TV unit there, okay, and then maybe a dental lab, and so on. So these kind of areas for you to accommodate, it takes proper designing, and it also takes some kind of a proper planning in the space management. Okay, so every additional chair that you add, you need to have about 50% of the area. So if you are keeping about, say, one dental chair, you are looking at about 60 square feet for one dental chair, then another 60 square feet for another dental chair. And then we keep on adding that area, because more dental chair means more number of patients and more number of visitors coming in. So when you have more visitors coming in, you also have to have more number of visiting area chairs, and more number of waiting area space also is required. So the area that we are talking about for one dental chair, it gets multiplied when you have 2 and 3 and 4 dental chairs. Okay. And there has to be sufficient space also between the two chairs. Now, there are two options. One option is for you to have two different rooms with dental chairs, or you can have one bigger room with a curtain in between, having two dental chairs in it. And the space between the two dental chairs could be about 1 to 2 meters. That's the kind of space that we're looking at. Yes, so this is the space that I was talking about, at least about 1 to 2 meters. And there are certain statutory compliances that we have to have when it comes to the licensing part. The first and foremost is the to set up the clinic itself is the registration of the district health authority. In some places, let's say for example in Karnataka is KPME, and then in other places it is the relevant district health authority that we have to have a registration with. Second is the pollution control board authorization. Third is the MOU with biomedical waste agencies. There are certain private agencies which are available locally. For example, SEMBRAMK is one of the agency, and there are many agencies available at different places. So you need to have a MOU with that biomedical waste agency too. Third is the AERB registration. AERB registration, basically this is for your OPG, for that matter, intraoral camera and CBCT. These have radiation. So as per the Atomic Energy Board regulatory, we have to have registration with that authority also. This is supplied or assisted by the relevant company which sell you the machine. Okay. Then lift license. If your company or if your clinic has a lift installed and the patients are using the lift to go up and down, maybe if a clinic is on a different floor, then you have to have the lift license. But if you have a clinic which is only on the ground floor and one level and doesn't really need the lift, then you don't really get into that category of getting the lift license. But if it is on the upper floor, then patient has to use the lift, and therefore the lift license become mandatory there. Pharmacy license is not really applicable as such unless you have a separate pharmacy store. And then fire NOC is a must. Okay. If the fire NOC is not available, then at least we need to have a third-party audit of fire and electrical safety. So these are the compliances that one needs to follow. And then we have biomedical waste handling. I believe there's a separate presentation for biomedical waste handling, so I won't go into the details of that. But as you know, that we have different categories of biomedical waste bins, being the yellow, red, blue, and white. And these have different items that we need to discard. That I think the next presenter will get into details of that. Yes, so for the Pollution Control Board, the requirement is to have the biomedical waste authorization. Once you have that MOU with biomedical waste, Pollution Control Board is easy to get. Next is the District Health Authority. At many places, it is the Clinical Establishment Act, which is relevant. And let's say in Karnataka, you have KPME, like I said, and in other districts, other cities, you have the relevant district health authority where you need to get the registration done. ARB regulatory board, this is mandatory for radiological equipments, and QA testing has to be done. This testing will be done by the radiology officer who will be supplying the equipment. And then you also need to have the registration done on the ARB website. You have to go into something called ELORA. On the website, you have a section there, and get your institute registered there. Okay, so that is the requirement of ARB. Then if you don't have the fire NOC, if your building where you are renting out, it doesn't have a fire NOC, then you have to at least get a third party fire and electrical audit done. This is to be done by certified fire auditors only, and also making sure that you have compliance with the electrical and safety requirements. Yeah, can we go next? Then lift license. Again, if the clinic is only one floor, it's not really applicable to you. But if it's on multiple floor and then your clinic is on the upper floors, then you have to have a lift license. Again, this lift license will be given by the company who provides the lift. And there has to be display of all the display instructions, the lift instructions, operating instructions in the lift has to be displayed. Professional liability insurance, this is something that we all know it covers the individual, and also you can have it for the individual clinic, wherein it actually helps you in minimizing the damages that any client can file a negligence case on you in case of any mismanagement of the medical procedures. So basically, these are the limited things that we have in planning and designing of a dental clinic. We have given a very simple flow of planning and designing, because we believe that if the area of the dental clinic is not too big enough, then in terms of the space requirement, in terms of statutory compliances, and also in terms of the lift and the other fire compliances, once these things are taken care of, along with the other registration, more or less the planning and designing can be taken care of. The rest of the things will fall as a part of interior designing of the lab. Interior designing of the clinic, wherein there's no limit as to how much amount of money you can invest, be it in flooring or fall ceiling or furnitures or interiors and electrical fixtures and so on. But you have to make a proper budgeting as to how much you would like to spend on that, and then proceed accordingly, keeping in mind these compliances and guidelines.
Actually, one question I can see here in the chat box, that what is
Yes.
the approximate minimum space required per chair for employees' health insurance schemes of state? So,
Employee health
request, sir.
No, there's no such space requirement that I have come across. Because when we design when it comes to ESI, I think ESI comes under a picture when there is more than 10 staff on the payroll in the clinic. And as far as we know, there's no reference to how much of space or the space requirement changes in terms of having the more number of employees. It's always depending on the number of chairs and not the number of employees. Because as I said, that when you have more number of chairs, then obviously the space area increases.
Is whether you could provide that what you mentioned about minimum space required. Would you have some schematic layouts anywhere where people can have a look into it, or you can provide them?
Right now, I don't have, but maybe I can provide after. Yes.
Yeah. Would you not mind to share?
Sure, I can do that.
Okay,
No.
email later on. So guys,
Yeah.
I think Dr. Vinod has made 2 points very clear according to me. Is that most of us go and buy the place first and then start looking of making things fit in. But I think what we were mostly unaware was the statutory requirements from the legal things which we normally would not be aware of, and we end up sometimes clustering the whole space that we have in trying to accommodate more chairs rather than fulfilling those requirements. I think those things he has briefly brought to our notice. Thanks, Vinod. I think it will go a long way now when we
Thank
see a place and find out what should fit in from a safety point of view, not only for ourselves, and of course, saving ourselves from legal news if it ever comes over our head. So I think a good beginning for today's evening, and some more questions that come up in the chat box can be addressed
Sure.
appropriately if time permits today, or on the group which will be there for some more time. We can exchange that. Thanks once
Okay.
again for taking out time and being with us, Vinod. Thank you.
Thank you.